Welcome everybody to our Life as a Clinician-Scientist Allied Health session today. Before we start, I would just like to acknowledge the traditional custodians of the land on which we meet and join from today. For me, it's the Boonwurrung people, and pay my respects to elders past and present. And we extend that respect to Aboriginal and Torres Strait Islander people who are joining us today. And really, the Aboriginal and Torres Strait Islander peoples were the first scientists, and they remain the spiritual and cultural custodians of our land. So I'm Professor Kim Burnell. I'm Director of the Centre for Health, Exercise and Sports Medicine at the University of Melbourne, and I am a member of the Academy, and I'm really pleased to be chairing this together with my co-chair, Professor Cathy Sherrington from the University of Sydney, who you'll hear from a bit later. So we're really delighted that all of you could join us today. We've probably got a mixed group of people. For some of you, it may be your first step in deciding whether or not you want to have a career that combines research with clinical practice. For others, you might be already on that journey, somewhere along that pathway, looking for some advice on how to improve or to stay on track. Perhaps some of you aren't sure yet what you want to do, but I think the fact that you've all given up some time in your busy schedules on a Tuesday afternoon to join us shows that you're committed, or at least a bit intrigued to find out more, and thinking about how you might merge sort of clinical life with research, and something that many of us have already done. And we've got a number of really fantastic allied health clinician scientists here to talk to you today, and I hope you'll make the most of their expertise, because I think you can always walk away from these sessions really learning something, or something that will help you along your own journey and career pathway. So today you can view the program online here, and that includes all the speaker biographies. You can look on this code here on the screen. So what we're going to do is to start the afternoon with two keynote talks from Professor Lauren Ball and Associate Professor Cade Patterson. And then we're going to have a panel discussion with the New South Wales Chief Allied Health Officer, Andrew Davison, and Dr. Mahiri Silva. And there's going to be opportunities for you to ask questions after each talk and throughout the panel discussion. And the speakers really would like to hear from you, and put your questions into that chat function of the webinar. You can also upvote questions that are there that you think you want to hear from as well. And again, before we start, I'd like to thank Leila Hilton and Jenny Famvo from the Academy for their work in really putting this together and hosting this today. And a really big thank you to the National Platinum sponsors. Couldn't do these sort of things without them. And these include the Centenary Institute, the Hunter Medical Research Institute, the Murdoch Children's Research Institute, the University of Melbourne, University of New South Wales, University of Sydney, and the University of Newcastle, as well as a number of other sponsors who have all really contributed to support this program. For those of you who are less familiar with the Australian Academy of Health and Medical Sciences and this sort of Life as a Clinician-Scientist Symposium, it is an initiative of the Academy, and the Academy is one of the 5 learned academies that we have in Australia. And we consider ourselves the impartial and the authoritative voice of health and medical science in Australia, really uniquely positioned to convene and bring together experts from across Australia to address the pressing health challenges. And we have, at this stage, 502 fellows from a whole range of different disciplines. And the way that you get into the Academy is that you're elected by your peers for outstanding achievements and exceptional contributions. And that's of all career stages as well, not just the more senior ones. So really, we have the brightest minds in health and medical research in the Academy. What we also do in the Academy, we do this by celebrating and strengthening research, by influencing policy, by supporting Aboriginal and Torres Strait Islander health and wellbeing, by being that sort of interface between health and academia and industry, and by nurturing the future research leaders. And this symposia and these symposia are really part of that nurturing these future research leaders who really are the key. And this Life as a Clinician-Scientist Symposia, it's a unique program of events that are held across Australia. They've actually been going for 9 years, and we've had more than 200 speakers sharing their wisdom across over 29 different events, and they seem to be just growing and growing. And we have Academy Fellows and other experts who really share their own career journeys, and I think, as you'll see, they're all very different, and as I mentioned, you can learn something from all of them. And what we're aiming to do is to inspire you to pursue and to keep on in research careers in the health and medical sciences. May not be necessarily easy, but really helping to inspire you. And it's a crucial part of the strategic objective of the Academy to nurture Australia's future and emerging research leaders. And later this year, we're going to hold the first event for those working in rural and remote settings. And so we hope that you'll also join our mailing list to stay in touch about other events that will take place in the sort of capital cities around Australia. And hopefully you'll find today really interesting and inspiring. So I'm now pleased to introduce our first speaker, Professor Lauren Ball. She is the Chair of the Community Health and Wellbeing at the University of Queensland. She has a clinical background as an advanced accredited practicing dietitian and an exercise physiologist. And her research career to date has been really exemplary. She's received NHMRC fellowships, a National Award for Excellence in PhD Supervision, fellowships of learned societies, several awards for research excellence. And she's really, as her title there suggests, focused on improving health of communities by creating knowledge and translating it into sort of real life scenarios and evaluating the improvements across primary care, community care, hospital services, allied health and wellbeing and health policy. So thank you very much, Lauren. We're looking forward to hearing from you.
Thank you, Kim. I'll just wait to be able to share my screen. Thank you. Okay, thank you, Kim, for that lovely introduction. It's an absolute pleasure to be speaking this afternoon, and also a pleasure to be a part of the Academy of Health and Medical Sciences, where I've been one of the mentees for the past 2 or maybe even 3 years now. I've entitled my talk today really about growing a research career as a clinician-scientist and an ever-changing game, and what I thought might be most useful for people considering a research career, I know when I was back in this position, was understanding how the landscape is changing so rapidly. So today I'd like to not only share an overview of my research journey to date. I think there have been 5 games I've been playing along the way that I want to share with you. And then also I have 5 tips for people who might be thinking about undertaking research as part of their clinical work or advancing upon their research, such as what Kim was explaining earlier. So going right back to the beginning, I've got to tell you where I came from. I grew up in Sydney and very much resonate with the Sydney landscape of research. I was a very straight public school student with no leg up into the research world, but I had a very important role model in my life. My mother was one of these trailblazing nurses, highly feminist, who undertook her PhD while I was a kid, so here in this photo, and said to all of us kids that you owe it to yourself to undertake research if you would like to make the world a better place. If you have the brains to do so, you must be part of the research world. And so I took that on board, and I guess I just naively assumed as I started undergraduate training that I would move on to do a PhD and have a research career. My first degree was in exercise physiology, and I had several roles in the exercise science space and utilising evidence in terms of practice. But it wasn't until I moved on to my second degree up in Queensland, where I did dietetics, where there was a structured research major as part of that program, where I fell in love with this idea of research. And really it just came about through, whilst working clinically on the side, I had an opportunity to sink my teeth into a study that someone else was leading, but looking into the way that nutrition is discussed within general practice and primary care. And for those of you online, some of you may know this already, but when we think about our general practice or primary care setting, we know that chronic disease is so expensive for this setting. It results in many, reasons for encounter in general practice, whereas lifestyle behaviours, specifically nutrition and diet, are fundamental in both the prevention and management of so many chronic diseases. We know that primary care is our front line of our health system in Australia. So I was naturally drawn to progress from a research major in my master's into doing a PhD alongside my clinical practice. And I was able to conduct a few projects and have them published, and I guess progress my way through the research process. And that's when I realized what the first game I was playing was, and that is that publish or perish mentality that you hear in research, that you have to publish if you need to prove that you can do research. I know that's been challenged so much over time. But I undertook some strategies to try and enhance the way that I was publishing research. So the two main ways I did that beyond my PhD was by joining other people and collaborating as much as I can, supervising honours or other students in any way that I was eligible or had the opportunity, as well as opinion pieces to practice my writing. There were lots of different topics that still advanced my area of focus around nutrition and health services. There were a myriad of questions that could be answered. And so I really set about doing that, as you can see on the slide, in terms of from a health system perspective, a patient perspective, a health professional perspective. And so therefore, I found that my research was able to grow and grow. Then I encountered a second game that I realized I was playing, and that was to get a job after doing a PhD. Then the name of the game was to have collaborations. And so not just what research you were doing, but who you were doing that with, and that international collaborations were really put you at the top of your field. And so I wrote to many different research groups around the world, and I might have told a few tall tales in the process by saying, I'm going to be in your area, or I'd like to move to your country, and can I work with you? And then I took the most highly ranked opportunity I had, which was at the University of Cambridge, where I spent close to 7 years absolutely loving my time, being able to immerse myself in another health system, continue to do research while forming some fabulous relationships with collaborators. And I still visit there, on and off now, even post-COVID. But by doing that, or taking that approach of reaching out to different groups, I was able to take what I was previously looking at in an Australian context and apply that at a global level. So I was able to work on some projects, specifically at the UN when they were conducting the Decade of Action on Nutrition. They had their main coordinating group at the University of Cambridge. And then I was able to keep my theme whilst expanding out my reach to global countries, including developing countries, and also work well with our partners in the WHO. And so it seems a bit like, when I've told this to other people, it seems like a bit of a fairy tale, but really all I was doing was playing this game that I realized was that if you can collaborate with people that have resources and have reach, then you'll be able to conduct really high quality research. Coming back to Australia, I must admit I got a big shock because I was able to secure an early career fellowship through the NHMRC, and I thought that the best thing I could do would be to conduct an RCT in general practice, which I did, and it was about promoting nutrition as my focus was. But I got a real shock when my supervisor asked me what the point of this RCT would be when it finished, and I didn't really understand the question. I thought that, well, I'd get it published and that's it. But I was challenged by her advice around how this would actually change practice. And it was really the start of the third game I realized that we were playing, which is, what do we do after we've created knowledge through discovery projects? And how do we do justice to implementation science and knowledge translation? So that really led to the next part of my research development, really understanding what it means to then create studies and trials where we are taking knowledge we already know, embedding that into practice. While I was quickly finding my feet in that space, though, then I realized there was another game that was coming up quite quickly in the Australian context, which was around an online profile for research. I realized that these very esteemed researchers who I admired greatly for their research outputs were having a voice on what was Twitter back then, and that was growing their impact and their reputation as a researcher. And so I was continuously learning and took myself off to some digital marketing professional development so I could understand the importance of having an online presence that allows you to create connections with other researchers and other stakeholders that can inform your work and grow your work and lead to, I guess, more genuine and more meaningful projects. Then lastly, the fifth game I want to share with you as I continued to develop my research career was after being successful in an investigator grant. And it was one of those situations, speaking honestly, where you put the application in not thinking that you'd really get it. So I was very surprised and very, very grateful, obviously. But the big dilemma I had was that I had to actually do the work that I said I would do, which really involved building a team. So that fifth game is the importance of building a team around you who can help you conduct research of a large scale. I very quickly went from working as a collaborator and on my own to then hiring my first postdoc. And then quickly, with a snowball of effect, we then grew to 10 people in our team, which you can see on the slide here. And it's even grown more recently. I think we're at about 16 people in our team. And it really taught me this game that you need people around you to conduct high quality projects, as well as seek opportunities for more work that will help with the momentum of research, which is important as you move from a sole researcher to, say, a whole research centre. So now, as Kim mentioned in her introduction, we have the Centre for Community Health and Wellbeing here at UQ, which focuses still keeping the same focus of nutrition and healthy lifestyles in primary care, broadening out to more community care. But now, rather than individual research projects where we describe a situation or a challenge, now we have 3 streams of research, focusing firstly on patients and their experience of receiving support. And these are some of the questions that we ask through our research projects that we have. We also have now a whole stream of work around health professionals, so not only GPs, nurses, but the suite of allied health in terms of how can they be supported with their own professional development, and their competence and their attitudes around nutrition and other lifestyle behaviours. And then fundamentally, from a systems perspective, how do we optimise our systems to make sure that nutrition and healthy lifestyles easily become part of the conversation? So really, the learning I've had through these 5 games, I feel like I've had throughout even my moderate career to date, have less been about how to do research, but really understanding what's happening in the landscape at the moment. So for those online who are thinking about what this means for them and thinking about incorporating research or growing research in terms of their work, the first tip I'd like to share is not to go to sessions like this and think that the people who you speak with you need to copy, not to compare your behind the scenes to someone else's highlight reel. And just to make a point of that, I want to show that if you put, my good part of my career on a timeline. It might look nice and shiny, but what you never see are all the rejections, and there's plenty more than I could even fit on this slide. So not to think that if you don't look like what you see, then you're failing in any way. So don't compare yourself to someone else's highlight reel. Number two, something that's helped me a lot is to find your vision and stick to it. So my vision is focused continuously on promoting nutrition and lifestyle behaviors in primary care, like I've been mentioning it. And I've used that to help guide my decisions around what to say yes or no to with regards to opportunities that come our way. And so many opportunities will come your way as you start to embed yourself in research. Here are some examples on a very practical level. So I've been asked to join projects or grants on lots of different topics in terms of lots of different aspects of health. And each time I've thought, does this relate to my research vision? Yes or no, or can I make it relate to that vision so that I can continue to go deeper and deeper and stay on track? My third hot tip is to make your own advisory committee. This is something I did early on in my research career while I was still doing my PhD. Although I had supervisors, I needed more support, I realized, for some of the work beyond research. So, for example, I appointed myself like a mentor for work-life balance. I appointed myself someone to go to when I wanted advice on my university work or my, looking for promotions, or for example, when I wanted to upskill in implementation science. And I found that by approaching people with one specific purpose when asking them for mentoring or support, it was far more likely that they were going to say yes, that they can help with this one thing. My fourth hot tip is to write everything down. So track your story and your progress along the way, because you never know when you'll be asked to comment on that, whether it be for a job interview or a fellowship application. Some researchers keep reflective diaries for projects. You could keep a reflective diary for your overall research experience. What was it like to meet with a stakeholder? What was it like to analyze your data? What was it like to present at a conference? And then you can draw back on that when you need to show your impact from your research. There are some fancy software packages like Impact Tracker that you can use, or fundamentally, I'm old school. I just use a Word document to track how I'm going. Keep dates of things that I might forget. For example, if there's a wonderful presentation like this, or a radio interview, or something where you want to recall the information later. And then finally, to have fun along the way. We know that this is a really challenging space to work in research, as well if you are working clinically. If you also are a female researcher, we know that life can be very hard in this space at times. I've had a wonderful time conducting research, even over the past couple of years. Here are just some photos of the great people that I've been able to work with. And by keeping a positive attitude, knowing that this should be fun, has helped me so much to reduce the likelihood of burnout, and just to be happy to get up out of bed each day and come and advance your research career. So thank you very much for the invitation to speak, Kim, and very happy to answer any questions, and for anyone to reach out on email or on socials.
Thank you, Lauren. That was fantastic. And people, we don't have 10 minutes for questions, so if you could please write your questions in the chat there, and we can ask those of Lauren. But while people are doing that, I'll just start. I think you gave some really good tips, and I had a laugh at some of the things where you didn't understand the question about research impact, which I think is really, research impact is only something that's been much more drilled into us, which is great, but more recently. So I think that was really great. I liked, you highlighted the rejections. Amongst all the successes, there are many rejections, and people don't see that. So they just think everyone that they hear about has been always really successful. So I think that was great. Your advisory committee, really good suggestions about different people for different things. So now I have some questions here. You mentioned the importance of building a team. What kind of values and experience do you look for in your postdocs and other staff?
Oh, that's a fantastic question. Well, I've been very lucky with my staff so far. Shared values amongst working culture are exceptionally important because, I mean, we all know online that if the culture of a team is not good, if we don't, for example, respect work-life balance or have the same vision for the future, then it's going to mean coming to work for everyone isn't good. So in terms of values, it would be really understanding the reason why someone wants to join a team, what they're hoping to get out of it. A bit like when you have conversations with prospective PhD candidates, you know, what are you looking for in terms of coming to work, and how can we make sure that this is a good place to work for you while you still contribute well and grow as a researcher yourself?
That's great. How do you keep up with snowballing research topics, scale of projects, and maintain a clinical caseload?
Yeah, absolutely challenging. There have been times where I haven't been able to maintain a clinical caseload. For example, the last 6 months of my PhD, also when I was overseas, also when I recently changed institutions. But however, I've always looked for ways to make sure I'm not losing the patient perspective and the patient voice. So spending time in clinics with students or being able to still have a foot in the door of clinical opportunities has been very, very important. But also I find that using a clinical perspective can help with the efficiency of research. It means that we are never short of research questions. So for example, we don't need to spend a whole day deciding on what the latest research problem is in the space of dietetics, where I mostly focus. So we are able to speed up. Knowing other clinicians means that data collection can be faster than if you were an academic with the door closed, not being in contact with the healthcare system. So it does take up time in the diary, but it creates efficiency gains elsewhere.
I've had quite a few saying thank you. That was great, which was really, that was great. But someone has asked, I spotted parental leave and working part-time on your timeline. How did you manage that time in your life with your career in research?
And well, firstly, recognizing that each woman will have a different experience. With each child, it'll be a different experience. To be perfectly honest, after about a month at home, I needed to have some stimulation for my own mental health. So I actually started doing a little bit of work on, in my own time when it was possible, in order to feel like I still had my connection to my, honors, my PhD candidates. So it was a savior for me, to be honest. And I know that that's not the case for everyone, but it did help. It didn't mean that I'm, doing work in the middle of the night or anything like that, but it actually kept me feeling like I still had purpose beyond the walls of my house.
Right. And you did mention a lot about sort of approaching people and, getting these networks, which is really great. But sometimes that can be difficult. And someone has asked, what is the best way to approach people for a new research project as an ECR and a new one to the system?
Well, each time I've undertaken an initiative that's really proactive, for example, I spoke about when I wanted to transition from PhD to postdoc, and I knew I wanted to go overseas. Also, when I was putting together my own, advisory committee, I took the mentality of you've got nothing to lose. So in each case, I had an email template that I adapted for each person I was writing to. In the case of wanting to find overseas opportunities, I researched who I was writing to and made sure that I, came across in an informed way. But for some people, I wrote 30 emails and heard back from 3, and that's still 3 connections that were able to progress onto a collaboration. So reaching out, not expecting much back. If you have something that comes back, that's great. That's your opportunity. That's the mindset that I have. If you don't hear back, there's nothing lost at all.
Did you use any, more experienced people who knew those people to do the e-introduction? Because sometimes that can be helpful as well if you sort of ask who knows someone who knows them and you can get them to set that up. Did you sort of use that
That's a great idea, Kim. And I haven't, although now that you say that, it comes to mind when I've asked for specific mentoring. So for example, when I have applied for a job or applied for promotion, and there's been a couple of times where I've thought that person over there would be great, but I haven't met them before. And then I've asked for someone to introduce me. Then I've often followed up with, can I buy you a cup of coffee? Or can we have a virtual cup of tea? Which is really what I hope I'm saying when I say that is I'm just asking for an open-ended conversation, no strings attached. There's no kind of expectations there. And the response often is very complimentary. If you put yourself out there, generally people, want to talk back. And if you put yourself in the shoes of, if you were in receipt of an email like that or a request like that, someone is admiring what you've achieved and would just like to have a conversation, generally most of us are going to say, yeah, sure.
That's great. Well, thank you. We've got a few more questions, but we've run out of time, so they might be able to be discussed in the panel discussion. But thank you so much, Lauren. That was fantastic, and it was really great to hear, those tips, which I think were great. So thank you. So it is my pleasure to now introduce Associate Professor Cade Patterson, who I know very well because he's one of my colleagues. And he is a podiatrist by background. He's an NHMRC Emerging Leadership Fellow and Dame Kate Campbell Fellow within the Centre for Health, Exercise and Sports Medicine. He's, as I said, a certified sports podiatrist and works at Lakeside Sports Medicine Centre. His research is in around sort of conducting large clinical trials and biomechanical studies on non-drug, non-surgical interventions for musculoskeletal conditions, with a particular interest in foot osteoarthritis. His clinical career has spanned about 15 years, and he's worked widely with professional and recreational athletes and clubs from around Australia. So thank you, Cade, for doing this today.
Thanks, Kim. Thanks for the introduction, and my sincere thanks to the Academy. It really is an honour to be talking here to everybody today, and thank you all for coming along. Lauren's a tough act to follow. We've both got a similar topic, but I've sort of approached it a little bit differently. My plan, essentially, I will cover a little bit of my past, but I think I'd like to get stuck into the weeds today and sort of talk about what a clinician researcher does, I guess, from day to day, and then also hopefully to give you some ideas of what you might be able to do if you're interested in going down that path. Ideas both in terms of things that can help, but also some barriers to getting there. Well, we've all sort of seen something similar to this in the past. Basically, your career, you start at school, you've got this great idea, you want to work in this particular field, and so you go and you do your course, you do pretty well at it. You get that wonderful job and you work away and you earn the hungies as you go through, but it's not quite like that, really, is it? When you kind of look back, it looks pretty smooth, but when you are in the weeds, as I was saying before, it is a bit of a mess. And really, to get from that starting position to that ideal job, there are all of these little branches along the way, and it's really confusing and it's really difficult at times to know which way to turn. And certainly myself, I know I had a number of moments throughout my career where I found it really difficult. I didn't know what I wanted to do. And hopefully, as I talk through today, I'll talk through some of my rationale and thinking for how I got where I am. And hopefully that can apply to your career path as well. So this is my clinical path. Like Lauren, I started at exercise science, but I guess my reasons weren't so robust at the time. I didn't do particularly well at school. I was probably average, a little bit above average, but I just really liked biomechanics of all things. I'd done probably 3 or 4 weeks in year 12, I think. And then I went away and thought, what's biomechanics? What can you do in biomechanics? And there really wasn't much. So I did exercise science, and we did a bunch of stuff related to human movement, but it was biomechanics that I really liked. And when I got to the end of it, thankfully I'd gone well enough at university that I got offered an honours year. And my honours year, funny enough, was in biomechanics, and my supervisor at the time, Associate Professor Noel Lithgow, had developed some stuff looking at foot biomechanics. And so I did that for the year, and I was absolutely fascinated, and I didn't know much about it I knew I wanted to sort of not just analyze people, but I guess I wanted to help manage people as well if they had a problem. And so I sort of looked at all of the different options. I looked at medicine, I looked at physio, but as you can see, I chose podiatry. I found a little brochure. It looked amazing. It looked like, this medical specialty without, having to do the 4 or 5 years at the time beforehand. So I went off and did podiatry, and I really enjoyed it. I really did enjoy it, and I became a podiatrist. And then over the years, I've sort of worked my way into the sports field. Essentially, I won't go through in detail about that pathway, but again, I think the opportunities that came through research really do apply to my clinical work, and now I'm very fortunate enough to work in a sports medicine practice. But I, like Lauren, got the research bug. I got it very much in my honours year. And so after I finished podiatry, when I was working clinically, I really wanted to do a little bit of research. So I went back to Noel Lithgow, my previous supervisor, and I asked him if there was anything I could do. And funny enough, they had a little bit of work in the lab, and I got a little bit of work as a research assistant. And I did that for a couple of years, and I think the bug grew into a full-blown infection, and I loved it. I absolutely loved it. And so then went off and did a PhD. And I was really fortunate that within my PhD, I had something called a studentship, which essentially was a 50% student PhD student position and 50% teaching position, and it rolled into a teaching position at the end of the course. So I think I was really fortunate in that regard. And look, that was great. I was working at a fairly teaching intensive university, and there were really few opportunities to do some research. I was doing really small scale projects. And around that time, I saw a position come up at the University of Melbourne with Kim's group, funny enough. And I spent a lot of time sort of crafting my CV and studying essentially everything they do, and I applied for the position and was really fortunate to get it. That's a snapshot. I guess I kind of want to talk to you about how that process happened for me in particular. And as I sort of said before, it does look, when you look back, like a clear path, but each of these steps along the way, really, there were a lot of decisions, and I really felt like I could go in a number of different directions. But there were a number of things that kind of came through at the time that were really, really important, I think, for me at the time, that have resulted in where I am now. I'm going to highlight a few along the way, but I'll sort of start with these three, and I think I'll come back to them. You really do need a passion and a curiosity for research, a passion for doing this work and for trying to discover questions. And that's where the curiosity comes in as well. So, sorry, trying to answer these questions. A clinician researcher, I think, really is a symbiotic relationship. You work clinically and you see people, and it doesn't matter what your field, whether you're a dietitian, a podiatrist, a doctor, you have people that get better. You may not know why they get better. You have people that don't get better, and again, you don't know why they don't get better. And you're really fortunate then that you can go to your research world and go, well, hey, I've got this really key question. Why does my patient with, for me, plantar fascia pain, why are they not responding to this particular treatment? And so you can then go and try and answer that question. What was really important for me is that I had that passion, I think, and that really stemmed from my clinical work. But I was really fortunate to be surrounded by some key mentors and some support. And I'll talk about the importance of those in a moment. And I think what's really important with those mentors is that they are a diverse group. And I had clinical mentors, I had research mentors, and I had, I guess, professional mentors that were really outside of my field. The other thing is you often don't know their mentors at the time. Often they might be friends or they might be colleagues. Some are older, some are younger. And they're people that you can chat to, have the cup of tea, as Lauren talked about, or they might be people that you really do seek out. I think the term mentor is probably one that you can use loosely. And like I said, really do tap into your network and see what people might be able to give you in terms of advice for your career. The other thing, unfortunately, although you need to take your opportunities, there is an element of luck. And certainly with my position at Centre for Health, Exercise and Sports Medicine, they were doing a couple of projects around footwear-related research. And I had been doing some of that stuff in my teaching university. I was doing a couple of small-scale projects there. So I had a little bit of luck with that along the way. And I think like anything in life, you always need a little bit of luck. So now I guess I want to focus probably most of the talk on what a clinician researcher does and what they look like. And we can sort of pull that out of here, the University of Melbourne promotion guidelines. And they really engage what you should be doing and they actually map quite well to fellowship applications as well. And you can see if you're a clinician researcher, you're mainly doing research. We can see a big part of it is research and research training. So publications, research impact, and your knowledge gain in this is your research plan for the next 5 years. So it is all around research, but you'll see these little leadership components in there as well. And that's something that's often overlooked, I think, and perhaps not considered when you're moving into this particular field. So when I was thinking about what and how to sort of cover what we do, I thought to map it to this, what better than to look at my diary for last week. And this is my diary from last week, my actual diary. And I'll kind of point out how we can map back to those little bits about what we do. I'll talk a little bit specifics, but I'll try and keep it general. So if we look at the first, the research and research training, you can see that pretty much makes up the majority of my week, as it should, because my academic appointment is as a researcher. Things that I have done last week is supervise research staff. So we've got a couple of staff members that I'll oversee, a few staff members, also PhD and other student supervision. I've got a couple of PhD meetings in there, an honours meeting in there. This week in particular has been very, very busy, including till late last night. I've got a grant that was due in today. So you can see here in grey, I've got a lot of my grant work going through last week, but also paper writing is a big part of what we do. I've got some project planning. So on Thursday there, you can see I'm planning a couple of new projects. So we had some meetings around planning those new projects. What I didn't do last week, but I guess you could say that I'm doing now, is presentations. So not just conferences, also professional presentations, and ones like for the Academy today. And then finally, research testing and analysis, which in here was on a Saturday, and I didn't actually go to that one because it was a Saturday and I'd worked clinically in the morning, which I'll get to in a moment. But so certainly research testing is part of what we do. So that's the research and research training component. And for me, as I mentioned, I really did have a biomechanics background. And as I said, I was really fortunate that I could come to the University of Melbourne because they were doing some research on footwear. But one of the things that probably comes up a lot in these talks is that these positions are a little bit insecure. They're often short-term contracts, and it became pretty apparent to me that footwear wasn't going to cut it. So I had to expand. And so I moved into foot osteoarthritis, and in particular, as Kim mentioned at the start, into clinical trials. This was something that would be more likely to attract funding. And unfortunately, as a researcher, we do really need research funding to pay for our projects and often to pay for our positions. So I did move into foot osteoarthritis in particular, and then I was able to supplement that a little bit with some more of my sports medicine research, which was a passion as well. And I can remember we had a really leading researcher from overseas come and visit our centre, as we were very lucky to get from time to time. And we all had personal meetings with him, and he sat me down and he said, Cade, you've got a problem. Not only do you have one of the most least attractive diseases as your research area, you also have probably the least attractive part of the body. And that's going to be difficult to sustain your career. And he was absolutely correct. I've been fortunate in foot osteoarthritis, but it is a challenge to gain research funding in that area. So I have broadened my scope, in particular to knee osteoarthritis, which maps in with our centre's work really well. And more recently, I've expanded into hip as well. So I'll come back to this, but I think it's really important to follow what you're passionate about, but also to keep an open mind that you may have to broaden it slightly. The other main part I highlighted was leadership and service, and I do think this is something that's overlooked when you do go for promotion as a researcher. Also, when you go for fellowship and other applications, they do look for your leadership roles and they look for your service both to the university, but also more broadly to your profession. And so I have a few. Last week, there were only 2. So there's my centre's meeting there on Monday, and I'm part of our strategic group as well. But then I'm on a couple of boards. I'm on a president of one, I'm a committee member of a few, a co-chair of another one. And these are things that you acquire as you go. And these are some of the opportunities that you should look out for. And again, I'll touch on opportunities as well and thinking about those strategically. But these are things that you do need as part of your CV if you want to sustain a career as a clinician researcher. And then, of course, the other part of being a clinician researcher, I think I've covered most of those. So these are some of the things that you do for leadership and service. As I said, so your meetings, but also committees and roles, external roles. And then I didn't talk about media. So from time to time, you will be required to do some media, and it certainly looks good on your CV as well. But as I was saying, as a clinician researcher, of course, we also practice clinically, which I think is a real advantage to us as researchers. For me, I do every Wednesday and I do every second Saturday in my clinic. I've got a private practice where I work. And on top of that, I do a little bit of consulting as well. And that's usually for me, to clubs, both amateur and professional sporting clubs. And then finally, as Lauren touched on, we have a life, believe it or not, outside of this. And I'm a single dad, and I've got to look after kids. I've got one right next to me doing his homework now, smiling at me. And, you know, we've got commitments for that as well. And so personally, I think being a clinician researcher is actually advantageous for that, because you do have quite a degree of flexibility with your research world that you don't necessarily have as a clinician. So the last bit of the talk, I want to talk about things that you can do, and I guess some of the barriers and facilitators. So the number one barrier, I think, to being a clinician researcher is time. You know, it is time, or it does feel like time away from clinic or on top of clinic. But I'd like you to think about that, going back to what I said before, in a symbiotic sense, that they are really complementary roles, I believe. And it's a matter of thinking about your overall time and then breaking it up. You saw on my schedule how I broke mine up, and there are a number of different ways. I have 2 of my PhD students at the moment are clinicians as well, and they do something similar. It can be really difficult as a clinician developing a research network that enables you to go into the research world. There are no easy ways other than what Lauren talked about. Sometimes it's cold calling, sometimes it's tapping into your existing network. It might be, for me, or similar to me, my old lecturer and supervisor. Often to go for a research position, you need research experience, which again is really difficult to get. And so starting small scale can really help with that. Sometimes volunteering for a research project, but also applying for smaller positions like a part-time research assistant position. And they are competitive, and all of those things above can help with that. But I think things that help, as I touched on earlier, so really having a passion for your area and a curiosity helps drive that. It helps you sort of make the time. I touched on the research area. So for me, just foot and sporting foot wasn't going to cut it. I did have to expand, and so I did firstly into osteoarthritis and then into other joint areas as well. So having that flexibility to follow your passion, but to be a little bit open beyond that. I talked about the importance of mentors, and I really do want to reiterate that mentors don't necessarily need to be formal. They can be friends, they can be family. For me, a really important mentor was someone in the business world, and they really made me look strategically and think about a 2-year plan and a 5-year plan. So starting with where I wanted to be and then the smaller steps to getting there, which was really a business frame of mind that I hadn't encountered as a clinician, and certainly as a really early career researcher. And then it helps, I think, to be, if you're able to join a high quality team, which is a really flippant thing to say, I think, but where you have options to engage with particularly high quality teams, it can really help augment your skills, I think, and get I guess a springboard to help you really achieve more than you could have on your own, most certainly, but perhaps in a smaller group. So my take-home messages really are, you're going to have a lot of opportunities, and early on you take as many of those opportunities as you can. But you'll see my last point there is to think about your CV and where you want to go, and to keep those opportunities strategic. And often it's as important saying no to some as to saying yes. Finding your balance of clinical and academic load. I tried more clinic and it wasn't for me. I'm really happy with my balance at the moment. Answering questions of interest. So that does come back to your passion and feeding your clinical work into your research world and vice versa. And then, as I mentioned before, seeking out diverse mentors. And they can certainly help round out your career and your CV and your plans going forward. Thank you.
Thanks very much for that, Kay. That was great to hear all that. And just in the interests of time, we might just hold the questions and people can include those in the panel discussion, because you'll be on that. So I'm going to move now then to, if I can share my screen. Do you want to just stop sharing yours, Kay? Okay, so I'm now going to introduce Professor Cathy Sherrington. She is in the School of Public Health at the University of Sydney, where she leads the 30-person Physical Activity, Ageing and Disability Research stream within the Institute for Musculoskeletal Health, and she's Deputy Director of that institute. And she also co-chairs the Sydney Health Partners Musculoskeletal Clinical Academic Group, and so she's going to now introduce and lead the panel discussion. Thanks, Cathy.
Thanks very much, Kim. And yeah, what a delight to be sharing this with you, Kim. We've worked together over the years, as well as this sort of stellar group of people that we've brought here together. And really inspiring, different but complementary talks that we've had from Lauren and Cade. We might get all the panelists to turn their cameras on, because I think we're going to be seeing you all. So I just welcome, as well as Lauren and Cade. We're delighted to be joined by Andrew Davison, who's actually the Chief Allied Health Officer for New South Wales Health, the Ministry of Health. So yeah, he might be attending to something urgent and be back in a sec, I suspect.
No, I'm here. I just can't.
You're here.
I am here. I just can't turn my video on. It's been stopped.
Oh,
I think.
Never mind. That's okay.
Start my video. There we go. Look at that.
There we go. Yeah.
Yes,
So
wonderful.
Yeah. So welcome, Andrew. It's delightful to have you here. And we've also got Dr. Mihiri Silva. And so she's a clinician-scientist fellow at Murdoch Children's Research Institute and a senior lecturer in paediatric dentistry at the University of Melbourne. So yeah, it's fantastic to have you all here. And so I thought I'd just ask, first of all, Andrew and Mihiri to give some additional insights and perhaps about both of your involvement in research. So they're obviously going to be coming from different directions, both of you, and just see if you've got anything to add from the fabulous talks that we've had thus far. So yeah, I might hand over to Mihiri first.
Thank you. It was great to, first of all, thanks for having me, and great to hear those talks from Kate and Lauren with lots of really fantastic points. Look, I was thinking about it, and I think what we're starting to realize is that clinicians can engage with research at different levels. And what I've learned is working in clinical teams that some people may not have capacity to be as fully involved as perhaps I am and some of you are, but trying to sort of maximize that capacity within our colleagues, and I think that's part of what I really enjoy about being a clinician scientist. I certainly find, I think I love my clinical work and I love my patients and the families that I work with as a paediatric dentist. But you sort of see the limitations, the places where we need to innovate and do better, and it's frustrating sometimes, whether it's systems or the biology or whatever it is. And I guess people make contributions in different ways. When research sort of spoke to me, and I found it a good fit, but also sort of gives a place where I can work with my colleagues and my profession really to kind of build that capacity and really draw the strengths from each other. So
that's fantastic. Thank you so much. And so over to you, Andrew, and you might tell us a little bit about your background as well, because I guess it's not evident from your title.
Look, so I work for the Ministry of Health in New South Wales. I'm the Chief Allied Health Officer. In New South Wales, we employ 23 different allied health professions. I don't have any particular favourites, although I heard that dietitians are particularly, I really appreciated Lauren's talk today about dietitians. I studied dietetics many moons ago, and I think for me there's a really big need to support the environment, develop a supportive environment for research. I think we talk a lot about capacity and capability, but I also think that it's really imperative that at a system level, but also at a New South Wales, we have local health districts. At that local health district level or at the departmental level, we have the environments that supports that research. In I think all jurisdictions, you've got you've got the world's your oyster in terms of the patients you've got to be able to research in, and the questions you might be asking. But I think that the environments are really important. I suppose in New South Wales, we have seen some forerunners, some front runners in that, and I have to say that probably where you have conjoint positions, where you have professors of allied health that are there to support clinicians with their questions and develop that capability, we've seen a really strong growth in research within the public sector. And I suppose that a lot of districts are looking at those relationships with universities in particular around how to build that research capability, but also build the supportive environment around that.
I think that's that's really insightful. Thank you. And that actually feeds on to what was going to be my next question about what people think it sort of needs to change with some of our structures, and perhaps some of the models that you've seen work in terms of supporting allied health clinicians to embark on research pathways. We might go to Cade first, and then Lauren and Mahiri to give you a heads up.
Thanks, Kathy. That's the challenge, isn't it? It is really difficult from a funding perspective, as I touched on, for clinicians to move across. There are some clinician researcher fellowships. Typically, you have to have had a history of research in there and a strong history of research. They're very few though, whereas in the UK they have a number of fellowship-based systems enabling clinicians, say in the NHS, to go across and to take research positions. So I think some more funding in that regard would be really helpful.
Yeah, I think that's a great thing that potentially the Academy could help advocate for. I guess a number of us as allied health clinicians have actually had success in the more general schemes. So I also wouldn't want allied health people to be excluded from the more general schemes. But yeah, I have noticed that in other places there are sometimes some specific allied health schemes, which I think would be really helpful. Lauren, anything to add?
I think there's so much that we can do on many different levels. But the first things that come to my mind, firstly, embedding, this is something I think dietetics has done very well, but is embedding research as an expected part of clinical practice beyond graduation, which means that many programs will have, and I know this happens in other allied health areas as well, research projects that are then allowing graduates to be eligible for higher degrees by research. But then on the health system side, allowing clinicians to have leave to explore research. At a university level, we could enhance part-time PhD scholarships, clinician scholarships, and reduce some of the more structural barriers that we know fundamentally get in the way of busy clinicians feeling like they can even have the brain space for research. They're the first things that come to my mind.
Yeah, I think they're fantastic suggestions. I mean, and certainly within the university, we've been advocating for kind of different criteria to be applied when awarding scholarships, and it is kind of gradually moving. But yeah, certainly it is the model of the kind of the honours, the full-time student, and then straight to the PhD. Whereas we can all see from all our various professions the absolute wealth of that clinical experience brings to PhD students, and the much greater quality in my view of the resulting output. Mahiri, anything to add?
Yeah, I think the point I think that Andrew made earlier about the environment is just so important, and having visibility of clinician researchers and sort of recognizing, because it sometimes the successes might look a little bit different, but having that flexibility and recognizing that, but also encouraging kind of better connections across, I guess, clinicians and non-clinicians in working together in teams. And I think the more recent schemes sort of tend to sort of support that team-based approach, but also within different clinical teams as well. So there's obviously, for example, there's a lot of connection between dentistry and nutrition. So there's obvious synergies there. So supporting that as well.
Yeah, fantastic. Thank you. Now, I just want to ask, this is more a sort of personal quality. So something that struck me with both Lauren and Cade's talks was that really the resilience and the kind of not taking no for an answer, and the kind of thinking about novel pathways and kind of different ways to get where you wanted. I wonder, and Lauren, I think you particularly, I wrote down what you said about if you're sending an email out and sort of someone doesn't answer, And you said, if you don't hear back, then nothing is lost. And I think that's a really important attitude. But I think something that a lot of people actually struggle with. So I wondered if, you'd each like to comment on the role of kind of personal resilience and, what our systems could also do to help support and model that. And we might go with Andrew first.
Yeah, look, it is one of those things where you do need to have thick skin, but I suppose I hear in every setting, whether it's in research, whether it's in really, really senior executives, whether it's in people who go into management, there's this always an element of faking it till you make it, and I can't. I've had that experience myself. I'm suspecting that the researchers in the room have had that thing. I heard it sort of through Lauren's presentation. No disrespect, Lauren, but I do think so, because we all have imposter syndromes in any setting, and it doesn't matter whether you're a bureaucrat or you're a clinician or a new grad, and I do think that we need to live with that and be able to sort of go, that's okay, because this is the space I want to move into, and I've got the first step, and we can only take one step at a time. You can't sort of take the leaps. We can't, and I do think that there is a bit of that faking until you make it, and I can't sort of, I don't think there's any disrespect in that. I don't think that, but I would say, and coming back to a little bit what Cade said about mentors, and I wouldn't say that I have a mentor, but I do seek out very wise people for advice on a regular basis, and I think that if you can learn from others and take that on board along the way, then that's how you start to take the next steps and the next steps along the way, like we heard it through Cade.
Yeah, I think that's really insightful. I was at a conference where I think there was 1,500 women in the room, and people said, put your hand up if you've ever suffered with imposter syndrome. And, literally everyone, including all the speakers, put their hands up. And I think that's a thing in, modern life, is people being more authentic and actually kind of sharing that, which, I think is really helpful. Did anyone else want to comment on the resilience? I'll let you do your own order this time.
Just following on from Andrew, absolutely I have imposter syndrome, and absolutely I'm faking it till you make it. Even presenting at an event like this, I think, do you really want to hear from what I've been doing? Am I really going to cut it? So that's embracing that is so fundamental. But in terms of, Kathy, what you were saying before about resilience and resourcefulness, I would argue that clinicians in their practice are resilient and resourceful, navigating complex health systems, reaching out to different people who they may not have existing relationships with, all with the best interest of the patient at heart. So I see navigating a research career or incorporating research not that different. It's quite transferable. It's about using initiative, being proactive, and not taking things too seriously along the way.
I think, that's fantastic advice. And I think, that's actually where it's an advantage for allied health clinicians being researchers, because, we are used to working in teams, and, we are used to problem solving. And yet some of as someone said before, the modern requirements to work in a more multidisciplinary way is, really difficult for some people. So, I think that's a great way to look at it. Cade or Mahiri, anything to add on that?
I think Lauren summed it up perfectly with that slide of all of the rejections, and I think everyone on this call would have something really similar. You probably lose more than you win in this game, and it's just a nature of the work. And I think if you can not take that to heart and know that it's not about you personally, and then of course the famous saying that you learn more from your losses than your wins, I think is really important. So you take that feedback on board and you go again, and it's grants and it's jobs and it's papers. You you will have rejections along the way. It's just a matter of learning from those opportunities and using them to grow, I think, going forward. And I'll say it again, really not taking it personally. It's very, very important that you don't take that as a reflection on you.
Yeah, I think that's really wise advice. And I think we also, as people who have had more success, we do need to, get better at sharing the failures as well. I mean, I have an NHMRC investigator grant, but I got it on the 5th attempt, and that's a pretty common story. So yeah. Mahiri, anything to add?
Yeah, I guess I was thinking along those lines in sort of encourage that also encourages people to perhaps take a few more risks and sort of rather than sort of playing it safe, and maybe a little bit more innovative if we all feel a bit safer to take some risk. I do have to say, I think there is a balance though in that I think the way we recognise research and we it's still, we perhaps don't always recognize effort as much. So there is that, yes, we need to build resilience, but we also need to reward and recognize the efforts that are put in. So I think yes, I certainly think that sort of, and I think more and more people sort of acknowledging the many failures along our way, and I think sharing that with the next generation certainly sort of gives them some security, and as I think Kate said, not to take it personally. It's yeah.
I think that's great. Just a question, and this can be for anyone, but perhaps partly for Andrew, not to put you on the spot, but I think both Lauren and Cade talked about the way that they've managed to keep up clinical work, but that's been primarily in private practice, and I guess that's probably the case for Mahiri as well. And so I'm wondering if, that's something that our public systems can look to, is, perhaps looking at some of those more kind of fractional appointments, or kind of allowing people who are primarily researchers but to do sort of some clinical work. And I feel like our medical colleagues might be kind of better at doing that than perhaps we are in allied health. Any thoughts on that?
Look, I would love to have more researchers with fractional clinical appointments, or the other way around, whichever one you see it. And the reason being, first of all, I think that it's a really good recruitment and retention strategy, because once you progress through your career, there's really some natural progressions for people. You can do what I did and moved into management. You can move into project work, but for me, I think I would love to see more and more clinicians move into research, and in that way they're honing their clinical skills more, and then we can use those clinicians to be able to foster and develop and mentor other clinicians. Look, I see some light in the tunnel, but I'm not sure that it's not as widespread as what I would like. And I think part of that reason is because while we have many part-time staff, we often don't have the component of their research which is funded, and that's where I think things like some of these scholarships and grants and university appointments could work really, really well. And I think that as you mentioned, Kathy, breaking down the barriers around that is important. And for me, it's asking, if not, why not? Why can't we do that? I think the other bit we need to look at, we have an interesting profile in our workforce in New South Wales Health anyway, where we've got a bit something like this, where we've got a bulge in the middle of our junior team leader. We've got team leader positions. We've got very few people who are paid at that top of the senior clinical positions. We've got lots of managers in that space, but not many clinicians. And I think we've also got to then recognise that these these clinicians who are really, really experienced clinicians, but also have PhDs, that we want to be able to remunerate them for their clinical expertise and this clinical specialisation, and support them with reducing maybe some face-to-face to do research, to support, to lead, to be those clinical leaders. And so for me, I think it is about that. That's part of that supportive environment that I was talking about before.
Yeah, I think that's fantastic. Did anyone else want to comment on that issue?
Yeah, I might jump in, Kathy, because I have a public appointment. So I've been very fortunate to benefit from the Clinician-Scientists Fellow Scheme at the Murdoch Children's Research Institute, which is connected to a .2 appointment that I have at the Department of Dentistry at the Royal Children's Hospital, which is a very busy clinical day where I'm, really busy treating my own patients, and we're supervising our registrars. But it does allow me to do, quite a bit of leadership within our department. So I do have to acknowledge that. And also at Melbourne, we have the MAC, track, and where the hospitals are actually contributing to support specialists training. So I think that includes a number of medicine, physio, nursing, and a number of allied health professions, as well as part of their training that they get protected research time. So I think, there are some really important and innovative programs that I'm aware of, just a couple that I thought of, which is absolutely the direction that we need to head to.
That sounds fantastic. I mean, maybe that's something that the academy or maybe some of the researchers could even take on to try and sort of document and share, some of those models, because I think that sounds fantastic. Cade or Lauren, anything to add?
As a private practitioner, it's a bit of an alien world to me, I think, Kathy. I was really pleased to hear Lauren say that dietetics involves research after graduation. But having spent the majority of my time in private practice, I haven't had much of a window into that world.
Yeah, but then to me, that's also, a massive positive to have private practitioners doing research as well. So Lauren, anything else?
I think that Mihiri covered it so well, but what I am thinking about now is that for anyone who's conducting research on the workforce, which our team does here, even for those who aren't directly seeing patients, engaging with health professionals as part of, say, for example, the co-design of projects or describing challenges they're facing, it still helps to make sure that we have clinically informed research, which is so important. So in our team, we have clinician researchers on the front line, but we also have those that are taking a break and still contributing to advancing the knowledge in this space very well. So I feel like we can lean in and lean out of our patient-facing commitments throughout our career in a way that suits us.
I think that's very insightful. And actually, Kim, did you want to add anything here? Because you've obviously thought deeply about a lot of these issues and different models as well.
Thanks, Kathy. Sorry about that. And also, just a suggestion, if people wanted to write some questions and answers in, you may need to exit your full screen to see the question and answer function. No, but there was a question in there about, for a clinician who is interested in a mix of clinical and interest and getting into research work, what would be your recommendations for the sort of pathways or the first steps into it? Like, what would you do? Would you go straight into a, full-on PhD, or what would you do? What would you be your suggestion? So I'm asking the question now, not saying anything.
I'm happy
That's all good.
Happy to go first, and others will probably be able to add to it. We have someone in our team who is a full-time clinician in the public sector, but is really interested exactly what you're saying, Kim. And she's doing a Master of Philosophy with, at the start, had absolutely no intention of upgrading to a PhD because that was for crazy people, she would say, but just really wanted to start to liaise with research teams and understand how research works. And that process literally started with an email reaching out to say, can we chat about this? I'm interested in understanding my skills, or even understanding if I'm eligible for some of these higher degree bioresearch programs. And really from there, I've seen this clinician flourish in terms of her own curiosity and her own skill set. She's now liaising with the grad school to understand the process of upgrading to a PhD, because she's seeing just the benefit and the joy that this brings. But similar to what Kate and others were saying, it's starting with an email, a conversation, and seeing where it takes you. There are others that have come to just visit for a day or join a research seminar just to feel like you're understanding what this culture could be before committing or changing your workload or anything like that.
I think that's a great suggestion. And
Yeah.
I think that also comes to the kind of being bold, and, you know, if there's someone doing something that you're interested in, then, you know, send an email or, you know, trip them up at an event to, see if you could get involved in some way. Sorry, Andrew, what were you going to say?
No, in New South Wales Health, that's where either clinicians who are researchers, and we've got a few of those, they're often in our quaternary type services. That's where we've probably got more of them. But definitely the professors of allied health, they're one of those sort of open door, that they often have an open door for people who just walk in and go, I want to do this, how do I do it? And they sort of they give them the glossed over version, but also give them the hard talking to, and help them work out their research questions. But I think for me, they've been a significant enabler to be able to drive some of this, and be that person to say, well, really, you need to consider this, or you might want to consider applying for a higher research degree. You know, these sorts of things. There might be some funding opportunities here. And so coming back to that initial comment I said, where we've had them in local health districts, our local health districts, we have many clinicians who have taken on research, either starting with a master's or going for the full PhD.
And I think we've had I think you mentioned, Kate, come in as research assistants first, and then they've done that for a couple of years, and then they've gone, actually, I want to do a PhD. So, a few of ours have gone through that route as well, where they wanted to trial it out first to see whether it was for them, and then gone on.
I was going to touch on that one actually, Kim, because we did talk about, taking opportunities and then, maybe rolling into a PhD, but we've got a couple, in fact, 3 excellent research assistants at the moment on various time fractions, and all 3 didn't have direct research experience. And it was, I remember the first time I was on the interview panel, and I almost disregarded them, and Kim and our colleague Rana Hinman sort of talked about previous experience hiring clinicians, particularly clinicians that had perhaps some administrative skills, perhaps some management responsibilities. Those are really solid transferable skills to the research world. And in fact, they've probably made better research assistants than some of the pure researchers that we employed. And they're absolutely thriving, and fingers crossed they might roll on into the horror of a PhD as well.
I think that's really cool. There's another question here about first steps in research and sort of typical career progressions. Would anyone like to comment on that? Mahiri, I'll put you on the spot.
Yeah, I mean, I was just thinking there's clearly not necessarily a typical path. Yeah. I imagine that, certainly all of us on the call and, clinician researchers I know come to research through different ways. And I guess there are different time points in life that might, or, these spontaneous events that happen that sort of get you moving in that direction. So I think, and I really think, within dentistry, and I'm a specialist pediatric dentist. So again, with our specialty programs, which are university courses, there is a formal research component. So some of the training programs do offer opportunities to sort of engage with research and maybe form some relationships that could then nurture sort of more of a research career. But I think the beauty of being a clinician is that, you know, there is always an opportunity to contribute, and I think and at different levels. I think we've heard that today. So, you know, and there'll be different times in, you know, that might drive you towards that. So I would never write it off. And I think it's very much sort of create your own adventure sort of thing, you know.
Yeah, no, that's exactly what I was thinking. And I guess some of the other comments and questions, you know, really are reflecting the complexity of the situation. So in terms of staffing levels and funding and, you know, managers not always being supportive, and can be, you know, difficult finding mentors. But, you know, from my perspective, there's a range of different pathways and solutions. So we do need to kind of be brave and, you know, think laterally about, you know, different ways of getting involved in things, and, you know, use some of the opportunities that are around. So, you know, there's also messages about some new clinician-scientist research pathways. So I think, you know, keeping an eye out for those and kind of asking within universities and also within health, you know, for more opportunities. So, yeah, I think that's been a fantastic, insightful discussion. I wish we could keep going for hours, but probably people have other things to do. So I might hand back to Kim. Oh, I think you might be on mute, Kim.
You'd think I would have learnt, wouldn't you, all these times? So that does bring us to a close. So thanks to all our speakers for giving up their time. It was fantastic for all of you for joining us and for all of your questions. Thank you again to our sponsors. Without them, that wouldn't be possible. But we'd really like to know what you thought. So if you could complete the online survey, give us some feedback, give us some suggestions for future events, what you'd like to hear, maybe some speakers you'd like to hear from as well, because that really helps us as well. Even suggestions around times, is this a good time, different times better, because all of those will help us in the future. So thanks again, and as I said, we'll just leave this here so you can take time to just fill in that survey for us. Thank you.